Both of us had problems with diet and nutrition during the course of our disease. In Ron's case, it was keeping too much weight on. In my case, it was keeping the weight off.
I've always been overweight. Always been overweight because I liked my food. As my condition got worse, I was told to eat healthily, which I did. I looked at food labels and I checked all the greens on them. But the problem was I wasn't sticking to diet. I was still overeating. So I was getting bigger and bigger and bigger. Unfortunately, what I didn't realise, this was affecting my breathlessness. So my wife looked online and we found the NHS app about calorie counting, which is what I started. We was measuring our food. We were sticking to the breakfast, 30 milligrams, and I was losing about a pound a week. And within about 12 weeks, my BMI was about 28, 29, and I kept it going for another 12 weeks. So it showed me that portion control was the way to go.
I was a vegetarian all my life. I always lived with a BMI of 22.5, 23 all the time. I had no problem with weight going on or weight coming off. After a few years living with idiopathic pulmonary fibrosis, IPF, I was becoming increasingly breathless, as we do with the disease. I couldn't walk upstairs. I could barely walk across the room at home. My wife was having to help me with showering and with dressing and things. I was in a pretty poor way. And at that stage, the weight really started falling off me. And I didn't realize at that stage how much effort is involved in breathing. And at that stage, I took advice from a dietitian and I started, completely contrary to my normal practice, I started adding full fat milk and cream to everything. I started eating biscuits, and I found the best way of all of getting a lot of calories in quickly was to go to the local burger joint and have a medium fries with a strawberry milkshake, which is worth 800 calories. I don't think we worried about the fact that, a Burger King was going to cause our arteries to flare up. That was the least of our problems. The problem was to keep the weight on.
And I think in my case, you wasn't really given advice by a healthcare professional. All the two advice I was given was eat healthily and lose some weight. So I think it was down to me, as Steve said. I was desperate to live and I would do anything to do that. So my goal is now to lose weight, do it slowly, and do as much as I can. I've also got the added problem that I've got what they call post-transplant diabetes. So I can't have anything sugary. I've got to watch what I eat. I have to take my sugar levels. Sometimes they can be high. Sometimes they're within limits.
I found that if I keep the weight off, sometimes I said I'm up a kilo or two, I'm down a kilo or two. If I keep it down as low as I reasonably can, BMI around about 21, then it's very much easier for me to breathe. I become very much less breathless. And it's and smaller portions of food make it possible for you to, your diaphragm's not raised up so much. There's more room for your lungs to breathe. So, I think you learn these things as you go along. I mean, I'm sure Ron and I have both been told that at different times by healthcare professionals. We've read it ourselves, we've experienced it. And that's kind of the way we muddle through, really.
It was about changing that food, changing that mindset on, I'm not going to have that cheese, I'm going to have a stick of celery instead. And that's what enabled me to lose that weight. But believe you me, it is so difficult to lose the weight and keep the weight off. Yeah. There's no time really to relax and say, I've achieved my goal. It's a life-changing thing that we need to adhere to.
But these are things, I think a lot of this is about patients' own management of their condition. Working out what works for you and going ahead with it.